Have you ever sprained your ankle badly and wondered what you could do about it? If you're involved in any type of sports like me, you probably want to figure out how to fix it as fast as possible so you can get back to playing right away. First, let's talk about the diagnosis of a sprained ankle. As Harvard Health explains in recovering from an ankle sprain, less common sprains are affecting the ligaments of the inner ankle and syndromatic sprains. Syndromatic sprains are most common in contact sports and are especially likely to cause chronic ankle instability. The severity of an ankle sprain depends on how much damage it does and how unstable the joint becomes as a result. There are 3 grades to the severity of damage. Grade 1 is a minimal stretching, no tearing, mild pain, swelling, and tenderness. Usually no bruising and no joint instability. And there could be a little bit difficulty bearing weight, but usually there shouldn't be much. Grade 2 is partial tearing, moderate pain, swelling, tenderness, possible bruising, and mild to moderate joint instability. Grade 3 is a full tear or rupture. Grade 3 consists of severe pain, swelling, tenderness, bruising, considerable instability, loss of function of range or motion. If you can't put weight on your ankle, you should see a doctor right away. In my 3.5 years of high school sports, I have never sprained my ankle or had any foot-related injuries. Then all of a sudden this basketball season, I have sprained both of my ankles. I sprained my left foot once and sprained my right foot twice. They both have been a grade 1 where I still had full range of motion and could put weight on it, but they were definitely swelling. The 3 things I did to help me get back onto the court as fast as possible were icing, resting, and elevation. As soon as I got home, I would get off my foot and stay off my foot as much as possible throughout the day. I then would spend 10 to 20 minutes every few hours icing my ankles and stretching them. The last thing that helped me was having my ankle elevated while I sleep at night. I didn't do any research on what to do before, but I did have some people tell me what the best steps were and told me what to do. If I would have done research, I could have found out that the steps I took were exactly what were advised. The staff at Mayo Clinic state in sprained ankle, the 4 steps for self-care are RICE: rest, ice, compression, and elevation. Starter Health employees also agreed on how to treat a sprained ankle that the RICE method was the best method for at-home treatment. The article also recommends if you have any ankle brace or if you have any bandages to help compress the foot, then that is advised as well. The one step I didn't use was compression. I never wore an ankle brace or used bandages to help compress my foot. There are ways to prevent spraining your ankle. As Cassie DeVlar states in Ankle Sprains for teens, stretching regularly can help prevent injuries. Doing ankle range of motion, strengthening exercises, and wearing a shoe that fits properly are other great ways to ensure you have great support for your ankle. Doing all of these will reassure that you won't sprain your ankle. One mistake most people will make during this process is stressing over the situation. H-Wave states, and chronic stress affects your body's ability to heal, that many studies have shown that stress can cause your body to delay the healing process. To make sure your body heals properly and fast, try to relax and take the first day as lightly as possible. Don't try to overdo anything and rush back onto the court. The last thing you can do is understand that in a couple of days, you'll be back to walking and participating in your sport. When I got back to the court, I changed my shoes and made sure before every practice or game that my shoes were tight and not loose. I also made sure to stretch before every game and found some good ankle exercises to help gain strength in my ankles. This seemed to work for me as I haven't sprained my ankle since. Knock on wood, it doesn't happen during baseball. I also try to get 8 to 9 hours of sleep every night to reassure my body had time and energy to heal. Within 2 to 3 days of my ankle sprains, I was able to go back onto the court and participate without any problems. The one thing I would recommend doing that I didn't do was using an ankle brace or bandages to help compress your foot. Thank you for listening.